I am sure that you all remember that early in the pandemic, health experts and even the CDC decided that the public could not be trusted with the truth about masks. Instead, they presented a misleading message that discouraged the use of masks. Now, most of their motivations were good. They were concerned that if the public felt that masks could protect them, there would be a significant increase in the purchase of masks, and therefore, medical grade masks would not be available for doctors, nurses, and other healthcare professionals. Experts were also not sure if masks would actually help prevent spread of the virus. But this was a significant mistake. Many people were very confused about mixed messages. It delayed widespread use of masks across the globe, and in the US, it made masks a bit of a political poker chip. It also damaged the credibility of public health experts, as people had to decide whether to believe earlier messages or what they had heard later on. Now, this same mixed messaging issue is at risk of repeating itself, as experts once again seem to think that they cannot trust the public with the truth. Now, this is about an interesting and very complex issue surrounding vaccines. I don't know about you, but in the US, when we hear messaging about vaccines today, it is full of warnings about their limitations. We constantly hear that they are not 100% effective. We hear that vaccinated people may be able to continue spreading the virus even once they have been vaccinated. And we hear time and again that people should not change their behavior once they have received a vaccination. Now, just as with masks, all of these warnings have good motivations and a foundation in truth. But once again, this is a misleading message. According to various public health experts and epidemiologists interviewed by the New York Times, the United States is very much at risk of underselling vaccines to the general public. These vaccines are going to save many lives, and the results of all vaccine trials have been ridiculously encouraging. So let's talk some details. I'll give you a brief summary of what we know. The Moderna and the Pfizer vaccines are the only two vaccines that have been approved for use in the United States, and they are among the best and safest vaccines ever created. All three phases of trials showed effectiveness rates at 95% after 2 doses of the vaccine. This puts both the Moderna and the Pfizer vaccine on par with some of the best vaccines that we have created to date, the measles vaccine and the chickenpox vaccine. The use of mRNA technology makes these vaccines safer than any other vaccine ever created. Speaking of effectiveness, vaccines actually don't even need to be 95% effective to lower cases and crush a pandemic. And if anything, 95% understates the actual effectiveness of the vaccine. Because in clinical trials, a mild case is considered a failure, when in reality, mitigating the effects of a disease is considered a success for a vaccine. So that 5% should actually be considered a success. Of the 32,000 people who participated in clinical trials in the US with these vaccines, how many severe cases do you think we had? In fact, there was only one. And it's true that no vigorous study has analyzed if vaccinated people can spread the virus, but it would be surprising if this were the case. A Harvard researcher has said that it is very unlikely and cannot think of even one vaccine that has this selective effect of preventing disease, but not infection. Now, of course, risks are not zero because nothing in this world is without risk. There is a small percentage of people who will have allergic reactions, and we are interested in hearing the data about those reactions. But vaccines should be greeted with enthusiasm, as this is the key tool to ending the pandemic. So why the negative messaging? As with masks, the motivations are good. Researchers are cautious by nature, and they emphasize uncertainty. It's part of their jobs. They are also nervous that vaccinated people will stop carrying out preventive measures, such as wearing masks and social distancing, and that unvaccinated people will follow suit and stop as well. This could lead to a dangerous surge in cases and even deaths. But I think we all know that the best prevention, or the best persuasion, is actually truth. People see through these misleading messages. These misleading messages can also feed anti-vaccination skepticism and conspiracy theories, of which there are already many. Now, I am not someone who likes to criticize without giving solutions. So what might be a better message? A better message might be, we need to be more aggressive with preventive measures like hand washing, mask wearing, and social distancing, especially with the rise of new viral variants. We need to vaccinate as many people as quickly as possible. And vaccinated people, once they have had their 2 doses and waited an appropriate amount of time, will be able to do things that others cannot do, like have meals or even hug their grandchildren. But until the pandemic is defeated, every American should wear masks in public, help unvaccinated people stay safe, and contribute to the global project to save every possible life. Thank you.